Our other healthcare hero in the nurse category is Jeffrey Couillard, registered nurse for advanced pain management. Jeffrey, who has previously worked as a charge nurse and image quality technician, has spent the past 9 years of his career with APM in Greenfield, where he has garnered a reputation for creating a safe environment where patients feel comfortable and understood. Jeffrey connects with patients by learning their hobbies, using music to comfort them, and letting them give him nicknames. What are some of those nicknames? I can't wait to hear.
I'm the old man at the place.
Okay, all right. Jeffrey brings his own personal experience of being a patient to his work. He was the first ever recipient of the interspinous spacer at APM to treat his spinal stenosis. His multifaceted background in clinical and technician roles also allows Jeffrey to take on a wide variety of tasks at APM, from scrubbing into procedures to providing post-op care. He has also taken on leadership roles. He was appointed Infections Control Officer at APM, through which he represents the healthcare system and healthcare conferences and educates the staff on best practices. Congratulations.
Thank you very much. It's an honor to be here. I'd just like to recognize the BizTimes. Thank you for the honor. I'd like to thank Kelly Brand, Julie Krause. Julie Krause was my supervisor for quite a few years. She's put up with me. It's been a wonderful time working at APM the last couple of years. And to the marketing department, thank you very much for submitting my name to be in this group of honorees here tonight. I'm really honored to be here. I've been at APM for 9 years. It's been a blessing. It's been a challenge, and we're one of the largest pain management companies in the area right now. We have 22 facilities and over 55 physicians. We offer innovative services and cutting-edge technology, which I happen to be a recipient of too, which is very important. 3 years ago, I have to say, when I was starting to lose my ability to use my legs, and it was challenging me to finish my workday, I was diagnosed with spinal stenosis. Talked to one of our physicians there, and they suggested I get a spinal spacer put in. But at the time, the existing spinal spacers were not that much better than getting the spinal fusion, which you all know we really like to avoid. But what happened was we were just starting to put in these interspinous spacers in at the time, and we were just going to be starting them in January, and this was November. I went to one of our physicians, and he suggested we have this new procedure going to be starting. I pulled out all the data on it. They had 5-year, 95% patient satisfaction. I said, sign me up, I will be the first patient. And it was wonderful. In February, 3 years ago, I had it done on a Friday. The next day, my pain was gone. A week later, I went and walked around the whole RV show up and down the stairs with no problems. 6 weeks later, I was able to take a 6-mile walk again. These are innovative procedures we have and offer at Advanced Pain Management. We're in an area where the U.S. uses 90% of the opioids in the world, which is just uncalled for. And it's been wonderful for me to share my experience of not having to take medications and to be able to function in this world. Part-time, I am a musician. One of the medications they tried me was a neurological modulator, which slows down your synapses in your brain. Unfortunately, when you're a musician, and when I was on the medication and I was trying to read music and I couldn't function, I said, I can't be on this, which led me to look for an alternative, which turned out to be the spinous spacers, which has been, just like I said, wonderful for me. And I'm more than willing to share this with patients as I continue on my journey to avoid using medications and to function, both as a nurse and as a musician too. So these things have really, really helped me. And I developed long-term relationships with a lot of my patients there. I always try to make patients feel comfortable. When I'm doing conscious sedation, I always walk out and tell all our patients I'm their bartender for the day, which in Wisconsin helps me out. It keeps them at ease right away. And then they always ask, well, what's your name? I just tell them, just ask for the old man, because I am the oldest person in our company right now. And I'm pretty encouraged with Bob Bunker as our CEO right now. We are really, APM's on the verge of expanding so that we can offer our innovative services in a larger function and to really take care of a lot more patients so we can help in the opioid crisis in the Midwest right now. And again, I'd like to thank you all, and it's such an honor to be up here with all of you tonight. Thank you very much.